everyone, this is Anjali here. So today we are going to talk about cervicogenic headache. So cervicogenic headache actually a kind of headache which originate from the muscles and the joints around the neck. One of the muscles which usually give headache is the sternocleidomastoid. This is the muscle connects to your skull with your collarbone. When you turn your head, you can feel a muscle kind of a band popped out. So usually the trigger point forms in this region, gives headache around the eyeball, the side of your skull, sometimes along cheekbones as well. One of the other major group muscles usually give headache is the upper trapezius, the muscle which connects your head, the neck, as well as with your shoulder. So this big group muscle usually tense up. Most of you might be feeling already the tension on the neck region. So the trigger points on these regions can usually give headache on the back, the base of your skull region, as well as around the ears. The other important group muscle is the occipital muscle. The muscle actually lies around the base of the skull. The trigger point formed through here usually gives headache to the back of the head. The back of the headache is quite common with people who are working with the laptop or the desktop screen because they have to constantly lift up the head to hold the head up through the suboccipital region. So what happens over a period of time, these muscles become tight and tense and the trigger points form, and that can give a headache to the back of the head. Cervicogenic headache actually can be misdiagnosed as a migraine headache. In some instances, both can give the same kind of similar signs and symptoms. We'll talk about the treatment options for a cervicogenic headache. So one treatment option is, as I said earlier, the trigger points release or a dry needling along the muscles. So the needle can be given through the deep tissues of the muscle, finding the tight knots, or which actually can giving the headache. So to do the dry needling to the SCM muscle, you have to let the patient to turn the head and clean it thoroughly with the surgical sprit, and then palpate along the muscle fibers to find the trigger points or muscular points to needle. Once you find the point, stabilize it and prick it with the needle. When you hit the tight muscle points, you can get some muscle twitches also. To do dry needling to the suboccipital muscle, position the patient in face down and then palpate along the hairline to find the muscle's point. Once you find it, stabilize it and prick it with the needle. So to do dry needling to the upper trapezius muscle, again you can do it either face up or face down, but you have to grab the muscles between your fingers to stabilize the muscle's point to needle.